Okay, I guess we can go, right?
We're all set.
We're live. Okay. We're live to discuss death. Anybody got questions from the prior class? I'm just going to momentarily reprise the point that I was making with respect to why the criteria for death were developed, because it is very important to understand what happened. Most of you already heard this, but
Can you speak?
I don't know. I'll try, sister. Maybe it's some background, because
Maybe if you put the microphone in.
that doesn't help.
That's for recording.
No. Okay, I'll start from the top for your purposes, John. We're going to reprise the differences between the purpose for determining death that have occurred historically, because they're very important. It's most important to understand that initially the criteria for death, the medical criteria for death, were established in order to determine when it was the proper time to give up on trying to save somebody's life. Somebody comes into the emergency room in very bad shape, and the physicians are working on them as hard as they can. The question arises, how long do they have to work before it is ethically licit to give up? And so they developed over time various criteria. Of course, see if there's a pulse, see if they're breathing, see if there are certain reflexes present. And in the absence of all of these, there came to be established criteria, which of course progressively became more sophisticated, to determine when it was licit to give up. When you stopped doing CPR, when you stopped using the paddles for somebody in atrial fibrillation, when it was morally perfectly licit to say, we've done all we can, so we stop now. It's not a question of whether we have metaphysical certitude of death. It is a question of the moral certainty that there's really nothing more we can do to bring them back. Yes?
The medical criteria, would you say it's changed radically from the Middle Ages?
Yeah.
From the Middle Ages compared to what it is now?
Well, I'm sure it has, and I'm sure it's changed in the last century. And we do have means to test to see whether somebody's alive that we didn't once have. But what's important to understand is that the purpose of all this was simply to know, when can we stop trying to resuscitate this person? Then comes transplantation. And of course, suddenly, the purpose became very different. The development of the Harvard brain death criteria was designed to allow a quicker determination of death in order to be able to harvest essential organs, vital organs necessary for transplant purposes. So that instead of the purpose being to know when we can give up on trying to keep the person alive, the purpose became, what is the first moment possible to declare the person medically dead, so that we can harvest from them an essential organ without which they cannot live. Very different purpose. Very different purpose. And again, we shouldn't get too concerned about the exact technology that's involved here. The technology for determining when to give up evolved over time, assuredly. The technology for determining when a transplant is available, that tends to evolve too. But what's important is it's a different purpose at issue. Philosophically, this would concern us. The first purpose is to just know when to give up. The second purpose is to know what's the first moment we can take an organ out of you that you need in order to stay alive, because we've managed to declare you medically to be dead. couple things to observe here, which I mentioned in the last class. Philosophically, we have to keep in mind that the determination of death is not a medical scientific issue, at least as to what is the nature of death. The nature of death is the separation of the soul from the body. That's a philosophical issue. In hylomorphic doctrine, the separation of the substantial form from the primary matter. There is no way on earth that natural science, medical science, can make that determination. So what do they determine? In a very real sense, it's not a medical question. They have to determine, as best they can, from the standpoint of physical behavior, the absence of the signs of life. The difficulty with that is that if you give signs of life, we know that you're alive. If you fail to give signs of life, we don't know that you're dead. You need a positive demonstration, some positive evidence that you're no longer alive. Taking a very simple example, which obviously doesn't define the issue, if you have a pulse, you're alive. If you don't have a pulse, you might be dead. But the absence of a pulse doesn't guarantee that you're dead. And the same thing is true, to jump to the Harvard brain death criteria. The presence of brain waves proves you're alive, but the absence of brain waves doesn't necessarily prove that you're dead. So we have a very serious problem in terms of having made this transition. Suddenly society has a great interest in getting organ donors, getting you to sign your organ donor backside of your driver's license, and convincing everybody that we need to be ready to go as soon as possible, or have our nearby relatives ready to say, oh yes, it's time to go. And pressure is put on people. You have transplant teams approaching relatives when one of their loved ones appears to have died at a time of enormous emotional stress for them, asking them to make this wonderful donation to keep somehow John or Sarah's vitality, their heart going in somebody else, giving them a kind of natural immortality they wouldn't otherwise have. So you can imagine the tremendous pressure that's on people to make this kind of decision. All the more reason to carefully reflect on the philosophical, the moral, the ethical, even the moral theological issue of whether transplants in itself is licit. Obviously, we're not talking about transplanting a kidney or something that you can live without. The real issue, and there are a lot of issues we kind of have to set aside, the real issue is, can you transplant a heart? Can you transplant a liver? Can you transplant something you simply can't live without? And that's where the difficulty arises. Now, while people tend to think of this as being a nice, neat, clean process where the medical scientists make a determination, use an electroencephalograph or some other means to determine that this person is really gone, and then and only then is the organ removed. We have to look at the concrete circumstances as they actually occur. Let me give you a couple citations here which will illuminate what we're really dealing with. Here's one taken from William DeLong, a book entitled Organ Transplantation in Religious, Ethical, and Social Context. No Room for Death, New York, the Hayworth Press, 1993. A little excerpt from it. When there is doubt as to true death, much of the conflict over organ donation occurs. Here's a citation. Concerns that organ donors are not dead, despite a declaration of brain death, and that organ recovery process itself is somehow disrespectful and may indeed kill the donor. Although cadaver organ donors are declared dead, they hardly resemble patients who have died from cardiopulmonary arrest. In fact, they remind us in many ways of living patients. They are warm and retain a healthy color, which is no surprise because their hearts continue to pump oxygenated blood throughout their bodies. Digestion, metabolism, and elimination occur. Maintaining organs for transplantation actually necessitates treating dead patients in many respects as if they were alive. When the potential donors are pronounced dead, we do not follow the customary procedures of turning off the machines, removing the various lines and tubes, and sending the patient to the appropriate place in the hospital, the morgue. Instead, monitoring and intervention continue at maximal levels in order to protect and preserve organs should the patient have a cardiac arrest. Even resuscitation is considered essential. Now, this is not exactly what we normally think of when we think of a transplantation taking place. I'd like to give you a couple more citations. This is taken from a report called Rethinking Brain Death, which was prepared in 1992. Again, we need a little bit of background information here. The British scientists Evans and Hill examined the clinical record of data published by Wetzel on recent brain death organ donors. Following is what happened to a 33-year-old donor. Before going into the operating room, the patient was not diagnosed with hypertension. This is bad. Then, in the operating room, he was treated because his body did not move or respond to the incision. Before the intervention, now mind you, this is a donor, this is somebody already declared dead we're talking about. Before the intervention, his heartbeat was 90 beats per minute, and his blood pressure was 90/50. After a few seconds, with the jugulopelvic incision, in other words, they're in the process of removing the heart, his heartbeat increased to 105 beats per minute, and his blood pressure went to 120/70. If he had been a corpse, these values couldn't have increased. I'm really sensitive to this because I just had some minor surgery, and I do recall one of the things that they told me halfway through it is your blood pressure is now up to 165/95. And I'm thinking, well, I'm alive, but this is not what it should be. But this is the reaction of somebody who's alive. You're being worked on and surgically, and your blood pressure goes up. 3 minutes from the procedure's start, the heartbeat was 118 beats per minute, and the pressure rose to 150/75. After 11 minutes, he underwent anesthesia, and the pressure returned to and remained at the preoperative measurement. You don't even want to think of this, do you? All of these donors were paralyzed and ventilated only with oxygen and manifested similar dramatic increases in blood pressure and cardiac rhythm after the incision was made for the organ removal process. Such responses matching the norm rather than are the exception are identical to the indirect cardiovascular responses mediated by the brainstem as observed in normal patients undergoing therapeutic surgical intervention when the anesthesia is found to be too weak. If the brainstem were truly dead, there would have to be an absence not only of central respiratory response, but also of the central nervous system. Such reactions are in contradiction to the cessation of all brain function. One of the problems, too, you realize the brain is not just in your head. The brain is the entire central nervous system. That goes through your whole body. So when you say it is dead, what exactly do you mean? Again, the same report, Rethinking Brain Death, states, and I'm just picking up a few pieces out of it. From a physiological point of view, the brain is defined as the central nervous system. early brain death, this didn't copyright for some reason. I guess what we're talking about is formulations, such as the Harvard criteria, recognize this fact and define brain death as the death of the entire nervous system, including the spinal cord. Of course, we've just seen an example where that obviously wasn't working. However, clinicians soon realized that many patients who were otherwise brain dead retained spinal cord function in the form of spinal reflexes. These reflexes occasionally resulted in dramatic and disturbing limb movements, which came to be known as the Lazarus sign. It's always embarrassing to have your corpse sit up on the table when you're about to take their heart out. The invention and adoption of the brain death criteria is based on the presumption that the observation of a certain series of similar clinical cases, which historically all have had similar outcomes, guarantees that all subsequent similar cases will all have the same outcomes, whereas the reality demonstrates that if intensive care were continued, the person would have been able to survive. Just a couple news reports to consider. I know these are not clinically recorded cases in peer-reviewed journals, but they do make interesting reading. Striking cases have been reported in the newspapers, demonstrate that many times those who are about to be harvested for organs but weren't have gone to a normal life. Here we report only 2 cases. Martin Bonnette, 28, a young 18-year-old German in 1996, was on vacation in Italy on the island of Flowers in Ischia. After renting a motorbike, the next evening he was hit by a car and passed out. He was taken to the hospital where he was judged to be an organ donor. You normally get a better chance at appeals if you've been convicted of being a serial killer. They telephoned his father. "Hello, this is Cardinelli Hospital in Naples. Does your son have an organ donor card? Your son is gravely wounded. He's in a coma. We're sorry to say there's nothing more to do." The boy's father said, "Leave him as he is. I am coming right away. Don't touch him." The parents arrived by plane but were not admitted to see their son. After struggling for 3 days, by luck, he was successful in flying in a determined young German doctor who argued for 2 hours with the hospital personnel. Finally, they opened the steel door and there was their son on only a ventilator. The German doctor ordered, "Talk to him." The mother cradled her son's head and his eyelids fluttered. The young German doctor then said, "Let's get him out of here." The boy was taken to Germany and already on his first day opened his eyes. Today, Martin has finished his studies and plays basketball with no permanent lesions. Here's a different one. Carlino's rest of the story. On September 12, 1999, reported on a young girl, Luca Sara, from Aquinas, who came out of a coma after having been pronounced dead and who had been prepared as an organ donor. Just before they were about to harvest her, she asked for a cigarette. And the headline said, "They said she was brain dead." Well, this is enough at least to raise certain questions about the whole process of organ transplants. As I say, usually when I got through discussing this with my classes when I was teaching at the university, many of them were ready to pull out their driver's licenses and scratch off the organ donor donation part. We have a rather scandalous event that occurred in Ohio. This would have been perhaps 10 years ago or so, at the famous Cleveland Clinic. Cleveland Clinic had a protocol which allowed them to harvest organs, like the heart, 2 minutes after the pulse ceases. This is a Cleveland Clinic. So, please don't tell me it's because we don't have sophisticated, up-to-date scientific capabilities to make these determinations. This was so bad that the Cuyahoga County District Attorney looked this up in Ohio state law and had to send a letter to the Cleveland Clinic telling them that they had crossed the line over homicide and that they should cease and desist. Some of the things that they do to these allegedly dead people is to give them rigitine, which stops the adrenaline release, which is there to fight death. Some of the purposes also are to preserve organs. For example, I'll give them 30,000 international units of heparin, which is bad if you're brain damaged because it's 6 times the normal dose. And that's to preserve the organs. This is the one that really gets me. They had protocols ordering a morphine drip to prevent possible pain to the transplant. One is left shaking one's head here. But this is what happens when we get in a hurry. This is what happens when we shift the criterion, when we become concerned about obtaining the organ. Now, of course, you've heard all the appeals for more organ transplant donors, and it is heart-wrenching to think of the people who are on the receiving end and need the donor, need the organ. But there is the minor little question of what are you doing to the donor? And we have the more serious difficulty that this is ethics. We have to be careful not to do little things like homicide. It's not quite kosher. And the difficulty is if you have a living organism, human living organism, and you remove something that is essential to the maintenance of its life, that is an integral organ within it, you have killed that person. And here's the difficulty. What do you do in case of doubt? This is the old business of shooting into a thicket and not being sure whether it's a deer or a human being. If you have any doubt at all, if you are not morally certain that it's not a human being and it is a deer, you cannot pull the trigger. The difficulty, and one doesn't want to get too far into all of the technicalities here, because obviously scientists are arguing back and forth about very detailed and sophisticated issues. But the difficulty is, you see, when you're asking how much longer do we have to work on this patient, this patient before we give up, that's one thing. You need only be morally certain that you don't know what more to do and that there's nothing known more to do that would help them in order to know, all right, it's time to give up. But that's not the same thing as taking out a scalpel and cutting out their heart, which is what they now wish to do. In order to do that, you have to be morally certain that the person is dead. And the difficulty is that the various criteria that have been developed do not give us that kind of certitude. One of the reasons, just to speak in more common parlance, we understand Harvard brain death criteria. Obviously, they check other things like reflexes and so forth. But what we've been told is, well, you put an EEG on them. EEG, electroencephalograph. You attach these little electrodes to the scalp, and if there is no sign of brain activity for, 24 or 36 hours, in the absence of drug overdose, by the way, then they may be declared dead. To speak in terms of theology, I don't have it with me, but I believe it was Pope John Paul II who said that you have to know that there is clear evidence of irreversible, and the brain is dead. truly dead. But here's the difficulty. The electroencephalograph rests on the surface of the skull. It's outside the cranium. And it only measures down to something like 2 nanometers, or very, very. It can pick up signals down to a very, very low level of voltage. What is it? Nanomicrovolts. Doesn't matter what it is. But the point is, it only detects it down to 2. It can't detect further. And if you've got electrical waves that are below the threshold that the EEG can pick up, it doesn't get them. Worse than that, we know that to really be sure of brain death or brain inactivity, you have to go under the skull. The EEG doesn't do that. You'd have to actually check the cerebral cortex, cerebellum, cerebrum, make sure there's no activity. And there's only one place and one time that you really can do that. That's on autopsy. So how are you going to do it? How are you going to do it? How can you be really certain that there is irreversible, absolute death of the brain? And certainly that's a wild distance from what they're doing at the Cleveland Clinic.
Has the church come out with a clear statement on medical ethics involving organ donors?
I wouldn't want to say. I think what you get is conflicting criteria at the magisterial level. I think what you get is statements that you absolutely can't perform it if there is a possibility the person's still alive. And then, of course, you have other statements that recognize the great charity entailed in organ donation. And there is, in principle, nothing wrong. If the person's absolutely dead, of course you can donate the organ. The problem is the transplanters don't want them. Why? Because they're dead.
They're rotting.
They're rotting. They're decomposing. They want them, as I said in the last class, warm and dripping. So we have a huge gap here between the theoretically possible and the practical reality. The practical reality, I would say, is we simply don't have the means at present, and possibly ever, to be sufficiently certain that a person is dead, that the soul has left the body, in order to make it ethically justifiable to remove a vital organ. Because removing the vital organ will kill them. Now, some ethicians have tried to make the argument that, and even there, they're presuming you can get around all this medical difficulty I just raised. They make the argument, you could just go by the brain being dead and not the rest of the body, because the rest of the body is not really functioning in union with the brain anymore. I think one argument was that the soul is no longer exercising its power over the entire body on a self-actuated basis. In which case, let's say the heart stops beating, but you could re-stimulate it, get it going in someone else. Now, I think there's a difficulty with saying that the criterion is whether it's self-actuatable, because there are many times you're not self-actuatable. You need some help from outside to get going. And you can't just say, this fellow couldn't get his own heart going again. We'll put it in someone else and give it to him. Because if it can be gotten going within him, of course, what they're trying to do is conjoin that to the idea of the brain being dead. And by the way, there's another argument they're giving that, we know the brain is dead, and if you don't harvest the heart right now, it's going to stop beating anyway. But of course, that's a prediction, and in many cases, it doesn't turn out to be the case. I mean, I have my own grandnephew had. A year ago, Christmas, he got involved in a horrible accident where he was literally minutes away from them determining to pull the plug from the resuscitation. His brain was in such horrible shape, they figured if he survived, he'd be in a vegetative state the rest of his life. And they were just about to pull the plug, and one of the members of the family noticed a toe twitch.
A what?
A toe twitch. Something moved. That young man just is in the process of completing his nursing degree today. He's fine. And all of the doctors that worked on him were utterly astounded. You know, anybody in common parlance, not metaphysically or theologically certain, but the word miracle was used all over the place. And of course, you know, that is one of the difficulties. If you remove somebody's heart, it's pretty hard to allow God to work a miracle after the fact. You know, you kind of finished him off. So, but the argument that somehow the soul isn't activating the whole body, it's out of the business of activating it, therefore it's gone, I think this runs head on into the whole notion of hylomorphism. The hylomorphic doctrine says the soul animates the entire body, every part of it. And to argue that some part is not being controlled or animated, first of all, as you can see, there are very great practical difficulties in determining that. But what you're kind of saying is, well, the brain is dead, the heart's still functioning, but we don't think the soul is operating in that heart anymore. Well, what you're doing is kind of dividing up the soul, like it's here, but it's not there. Your soul is equally present in the whole of your being. It's equally present in your eyelid, it's present in your little toe. It's just that it isn't exercising every power in every part of your being, but it is fully present in every part. So this idea of dividing it up is really running against a proper understanding of hylomorphic doctrine. But in practical effect, I think you can see why it really doesn't seem to be feasible to render legitimate a doctrine that would allow for transplants of vital organs. If you want to transplant your kidney or something else, you got to spare one up, fine. But we don't really have that many. And you can't, it's not even ethically right to donate one eye, to give it to someone else, because you are mutilating something that has been given to you by God to constitute the fullness of your being. You may be able to get along without one kidney, but even then, you know, sometimes kidney donors die in the process of the donation. Nobody's going to guarantee, you know, usually they don't talk about the donor died in these paired organ cases, but they do. There is a risk. So this is why probably it's one of the beautiful applications of that metaphysical principle that a small error in principle leads to great errors in conclusion. We're now running around trying to find every way possible to get people to donate and to be signed up on registries for donation. And I guess one can only say you do so at your own peril. Death entails the separation of the body and the soul. The soul ceases to inform the body. The difficulty is we simply can't be certain when that occurs. What you're basically arguing is, well, John is so far gone that he's not going to need these organs anymore. And of course, there's two things about that needs to be said. One, whether John is so far gone or not, if he's still John, he's not gone. And doing something that makes him go is called homicide. And secondly, the argument that he's not going to need these organs anymore has too often been proven false. In too many cases, it turns out he does need them again. And, of course, the real difficulty is the cases where the person is really truly dead, the organ transplanters aren't interested in them. those are not the ones they want. They don't really want you when you're 95 years old and you've expired because everything died at the same time. That isn't what they're looking for. They want you young and healthy and vibrant and quickly judged to be gone. Now we might ask the question, when does the soul leave the body? That isn't easy to tell. As I said in the last class, it seems like the only sure sign, as it says in your notes, is putrefaction. The difficulty is that, like with gangrene, certain parts of the body may start to putrefy before we're dead. So that isn't an absolute guarantee. Morbidity is not an absolute guarantee. As I said last time, at one time I thought it was, but then they found a case where morbidity, all of the blood pools in one part of the body, somebody had morbidity and they came back to life. Very embarrassing. I mean, too often we've had cases where people were waiting to be embalmed and they objected. I would almost say, although I guess it isn't very ethical, that if you really want to be sure you're not buried alive, make sure you are embalmed. Because if you weren't dead, you will be.
If, as you pointed out, it is the soul that informs every part of the body, including the heart, aren't you forced to conclude that if the heart is still living, the soul is still there?
Well, if you have removed the soul, the part from the whole, it is no longer part of the whole. And every part of your body is part of the whole. We call it the heart because it's the heart part of the body. But while you're alive and it's part of you, it is part of you. And therefore, its substantial form is not called heartiness, it is called man. Every part of you has the same substantial form animating its being, including the heart. Sister?
So, in essence then, in order to determine that the soul is gone, and since it operates on all parts, even in different powers,
Right.
you would have to have a full body examination. You would have to have your brain examined, your eyes tested, your ears tested.
Yeah. What do we call that, sister?
I don't know.
I think it's sort of called an autopsy.
Well, why would it be an autopsy?
Because, as I mentioned earlier, to be certain that the brain is completely dead, you have to examine every segment of it within. And then
Within the brain. You
yeah.
can't give an eye test or...
Well, go ahead and do the eye test, but I want the brain test to be done. And there's no way to do it except by taking apart what keeps you alive.
Could it be like incisions in the brain? Can't they do something like that to determine?
You'd have to be sorting through the brain tissue from one end to the other. That's not a good operation. We don't have very many people survive. Well, you don't have to know much to know that if you take your brain apart and dissect it piece by piece, you're not alive. That's all you need to know.
So there's no one central...
It doesn't seem, this is the difficulty. It's nice to say, well, you can do it when you're sure they're dead, but the problem is there's no way to be sure they're dead except by killing them. And the difficulty, what we've shown here, and it's not just this report I read to you from, represents the thinking of many medical scientists around the world. Mr. Bonnette just gave me a book just now with, some 14 different authors?
Yeah, they're mostly against it.
Well, I know, but what is their background? They're
medical men. Yeah.
They're medical men, yes. And these are people based on medical science saying, you can't do it. So this isn't a matter of saying we have a consensus. It isn't a matter of every physician knows that this is when you're dead. We have very well-trained experts who are dissenting from within their own field. And remember, they're not philosophers. This is a philosophical issue. When are you dead? In practice, How do you know when the soul's left the body? That isn't an easy thing to answer. It would appear, and this is a conjecture, that it depends on the condition you were in when you were alive. So if you were 25 years old and you got hit by a freight train, the presumption is that the soul may be present for a long time because of the disposition, the active disposition of the soul to the body, even though you're terribly damaged, possibly up to 8 hours. Somebody who is 95 and died because just everything stopped working on its own, maybe 2 hours. But whatever it is, it's far beyond the time that transplanters want the organ. That's the difficulty. That's the moral dilemma. And remember, if we're talking about, I mentioned the conflicting theory that said, well, maybe the soul isn't activating the body. Maybe it isn't activating the whole body, therefore it isn't present. Well, maybe it is activating the whole body. Maybe the hylomorphic explanation is correct. You see, here's the difficulty. Remember, we were talking about when is one obliged to follow a law? And you get into the principle that the obligation arises if the law is clear. Well, the law is clear that you can't shoot into a thicket if you have the least suspicion that there's a human being in it. Isn't that right? In other words, the presumption of evidence is in favor of you don't kill the person that's there and might be there. Even if you remotely think they might be there, you must be absolutely morally certain they are not there. And that's the difficulty you have here. Posing a theory that maybe the soul doesn't activate every part of the body or something, that's a hypothesis. Even if you think it might be true, the difficulty is we have the overwhelming moral dictate that you cannot directly kill somebody. Therefore, if you've got two theories and one says they might be alive and the other says that they must be alive, you have to follow the one that says they must be alive and treat them accordingly. So the fact that you come up with some other philosophical theory to try to explain, well, maybe the soul isn't really there, that isn't good enough. You have to follow the strict one that follows the morally safer means. And the morally safer means is you don't kill the person when they could be alive.
But the question remains, for how long then?
Well, again, remember, there are two questions here. One is, when do you bury him? And the other is, when can you do a transplant? We're talking about transplants. As far as transplants are concerned, don't be in a hurry. And if you're not in a hurry, the transplanters don't have any use for you. So in the practical order, I don't see any room for transplantation myself. Now, you do have a further problem of when do you bury somebody? That's another one. And maybe it's a good reason to have a good Irish wake. Maybe it's a good reason to be rather slow about embalming. Maybe it's a good reason to have second thoughts about embalming. I realize, you do get into other difficulties, such as arose with Lazarus, but that's a different order of question. Our question is, are transplants ethically acceptable? And again, show me how. Until you show me how, I must operate on the moral principle that I would not sanction one. Obviously, I'm talking about of a vital organ. I'm not talking about your kidneys or your left little toe or something. Edwin.
How would the hylomorphic school construe the situation of recipient of an organ donation or a transplant or an artificial heart?
Person receiving it.
Does the soul continue to activate the body? Or?
That's a good question, and that's something actually I think I dealt with in philosophical psychology, but it's relevant here, at least by way of interest. what is one of the things you have to do? What's one of the big problems when you do a heart transplant? What's the big thing that you got to fight against?
Rejection.
Organ rejection. Because what that is the body saying, hey, you're not part of me. So we suppress, we use massive immunosuppressive therapy to keep the body from rejecting it. That's a hint that it's not part of the body, that what you have is a kind of symbiotic relationship where the body's providing the blood and circulation to the heart and the heart's pumping the blood for the body. But in a way, this solves itself. Look, either a substantial change has occurred or it hasn't. If it has, then the organ now is part of the living body, and it has the same form. If it has not occurred, then it isn't. So in a way, one way or the other, you don't need to know the answer in order to know one of the two cases is true.
But you've got a foreign entity, a foreign organ that's been inserted into the body.
You do when you
and
put
it's
it.
been appropriated by the soul, and
No, it may be being used by the soul. It may be being used. Look, we put pig valves into people, don't we? We put mechanical devices, mechanical valves into hearts. Are they part of the person? No. Is the person using them? Sure.
but in a sense they activate the soul, because without that foreign instrument.
No,
the
they
soul
don't.
is part of the body.
They don't activate the soul any more than the air that we're in here is activating your soul, but you die without it. You're using it as an instrument to keep yourself alive. And of course, we can put something inside you like a valve that then will mechanically be used by your body for that same purpose. It's just like a crutch. If you can't walk, use a crutch.
Or you're blind.
It's really, many of these seemingly difficult questions sort themselves out. As it's either it's part of you or it isn't. If it's not part of you, hey, it's not part of you. It's an accidental change. If it is part of you, okay, then you must have had a substantial change.
Just what you might want to comment on the connection in time between the rise of Joseph Fletcher's Situation Ethics, 1966, and Harvard with this new definition of brain death in 1968. This new kind of end justifies the means ethic taking over medicine about the same time?
Well, I think you've already commented on it pretty well. And this, of course, is why your medical committees, your ethics committees in hospitals are filled today with ethicists. They don't call themselves ethicians so much anymore. And most of these ethicists are utilitarians, which is what Dr. Fletcher was. It's a utilitarian position that says the end justifies the means. And if the outcome is good enough, then, we justify the means. And so I fear that somebody like Fletcher or Peter Singer would argue that even if in a few cases the donor would have survived, it saved so many people's lives that it's justified taking that risk. That's what happens when you cross the line against principle. The principle we must never violate is you cannot directly take an innocent human being's life. That's the principle. And flowing from that principle, you must infer what we have said about organ transplants. If you don't have such a principle, well, guess what? Organ transplants become a public duty.
Couldn't you say we started down that slippery road with abortion, now assisted suicide, and into this whole medical ethics?
Well,
Go ahead.
this predates the legalization of abortion. Harvard,
That's correct.
Harvard,
Yeah,
you talk about at least the United States.
Yeah,
But it's the overall thinking of the end justifies the means.
Right.
Go back and condemn Bentham and Mill, back in the early 19th century. That's where your problem is. Blame William James and his pragmatism, which is sometimes called the American philosophy.
Right.
If it works, it's good. So again, we are doing ethics in a theoretical domain, and You can't count on many people listening to what you say. And in large measure, much of the material I gave you tonight is not really ethics, is it? It's just an examination of the concrete medical facts which scare the living daylights out of most people when they hear them. And you're not just watching Dr. House saving somebody.
You said if it works, that the means would work.
If it works,
Good.
it's ethically good.
Good, but
Yeah.
mustn't you correct that, make it more accurate by saying that if it works, then the means were effective, which doesn't bring up good or bad,
But-
just effective.
It's effective, but in pragmatism, in utilitarianism, in pragmaticism, in instrumentalism, being effective means being good. The effective is then measured by what was the criteria what was the purpose you were doing it for. And if it saves a life, it's good. That's all.
No, it's
That's all.
effective, not good.
Well, it is for this philosophy. Yeah, you're arguing as a Thomist. I'm telling you what the pragmatist would say. And again, the problem in the practical discourse of the American society, pragmatism dominates. Pragmatism dominates. And therefore, in practice, you have these ethicists all over the place solving problems in terms of what's the best outcome. But very few people are concerned about, are you violating some essential moral principle that you cannot ever violate? And that's why there is no place for compromise on the question of homicide, whether it's in the case of euthanasia or abortion. Where is the compromise? The pragmatists are always saying compromise. And there is no place to compromise, because either you allow the direct taking of an innocent life or you don't. You're impaled on the principle of non-contradiction. There's no place to move. Let's just finish our notes here for a moment. The convertible cause of death is prime matter and its potency for other forms. In other words, it's because we are composed of form and matter that we are susceptible to dying. We're susceptible to the form being removed from the matter. And because we have this hylomorphic composition of form and matter, you can't have this composition without the possibility of death. And because you have to have that in order to have death. That's why it's convertible. You can't have death without it, and you can't have it without death. It's the composition of form and matter that entails us in this death correlation. To remove a necessary organ from a living person is to kill him. Transplanters want live organs. Can we be sure the person is really dead? You cannot act on a doubt where the act may be murder. And again, the perfect example, it's like shooting a possible deer. You have to be certain that it is a deer. So, is there anything more that we need to say about transplantation? Obviously, you're going to have people arguing that we've got newer and better ways of determining when death is there, but remember that what they're talking about is a sign of life that is now absent. And the fact that a sign of life is absent does not mean that the absence is a sign of death. That's what you got to be very careful about. If your pulse shows that you're alive, the absence of pulse does not show that you're dead. It doesn't work that way. You need a positive evidence of death, and that's where it gets really sticky to do it. Because even if you grant a brain death criteria, the difficulty is to determine that the brain is really dead, you virtually have to do an autopsy on the brain. And that's really not good for the patient. I don't really have more to say about transplantation. Go ahead. Because I know there are a lot of correlative questions you can ask. Go ahead and ask them, because I'm only going to go about another 5 minutes, and I don't want to get into truth.
I
Go
just
ahead.
want to see if I understand what you're saying. You said in the past we're unable to determine the moral certainty of death. Would that be correct?
No, I wouldn't say that. The difficulty we have today is that we are not able to determine death with moral certainty. Certainly not fast enough for transplanters. That's the point. I mean, certainly if, something happens to you.
Like if a person's heart stops beating, wouldn't that be a sign you're dead?
No, it's a sign that your heart isn't beating.
Oh.
I mean, if you want to know somebody's dead, okay, so they fall on a hand grenade and get blown to a billion pieces. Okay, they're dead. But I don't think the transplanters want them. I mean, you're looking at it in a concrete context. They want a heart that's in good shape. They want a liver that's in good shape. So you're dealing with somebody who's laying there, like the first citation I gave you, where the person looks like they're alive. And what we're trying to do is show that the brain is dead, and therefore you can remove those organs. That's where you get into the difficulties that we've gone through this evening. It isn't that easy to do, and in fact it appears we don't have any way of doing it that would tell us for sure that this person is so dead that you can remove the heart without, and still have it be in such shape that they can use it. To make it simple for transplantation purposes, we are poles apart. The criteria required to determine that they're actually dead is so far removed from the point at which they want to take the organs that in practice you could never take the organ. Transplantation, as we normally understand it, cannot meet the criteria that would justify it. By the time you even have a shot at justifying it, and even then you may never, even to have a shot at it, the transplanters don't want the organ. So what are we talking about? I mean, you have a better argument on the table here if you wanted to talk about when can we bury you. That would be worthy of discussion. And that raises some interesting questions itself. But as far as transplantation is concerned, we're miles apart. By the time it's okay to do it, you're hours far beyond where a transplanter wants the organ. And that's all you need to know.
I know it may be listed in organs that are in pairs, but is it, say if it's a spouse or a child, and you're the only person that could conceivably give this organ, are you any obligation to donate a kidney or whatever to it, if that's the only way to keep your child or spouse? Or
I don't think you could say that one has a moral obligation to submit to such an operation. And by the way, you notice the only example we practically ever come up with is kidneys.
they can usually be on machine.
I mean, you notice most other examples don't really come up. The place where you can have organ donation where it's okay probably would be cases where the person could have been dead for 3 days. They're on ice. Then you can remove, say, the cornea from the eye and still use it. That's not a problem.
Bone marrow.
Pardon me?
Bone marrow.
Bone marrow, okay. See, there are things you can do after clear death, where you would have a funeral if you wanted. But that's not what the fight's about. The fight's about the heart and the liver. That's what you see on TV all the time. So there are other areas where, yes, organ donation is fine, and that's probably what the church is largely talking about when it says it's laudable to do these things. But in no case does the church sanction that one commit homicide in order to do it. They want to be very sure that's not what we do. And certainly from the standpoint of natural law ethics, it's absolutely forbidden. in my judgment, it's up to you what you do with the backside of your driver's license now. You may want to burn it. Okay, any other questions on this topic? Because otherwise we're going to put to rest the topic for tonight. Okay, thank you very much.
Sound production copyright Olteen Library Services 2013. All rights reserved. www.aquinasphilosophy.com.